Welcome to the Dance Science Podcast. I'm your host, the Dance Scientist, and the Dance Science Podcast intends to build connections and drive discussion on how we can improve our field and make dance science more normalized. Thank you for being here with me today, and please enjoy today's episode. Hi, everyone. Thank you again for being here with me today. I'm your host, the Dance Scientist. Today is episode number 35. We're going to be having an amazing guest speaker today. Her name is Megan Richardson, and she's an acupuncturist and an athletic trainer. So first, thank you so much, Megan, for being here with us today.
Hi, Maria. Thanks for having me. I'm excited.
I'm really excited. So first, can Megan tell us just a little bit more about becoming an acupuncturist and an athletic trainer?
Sure. So I was an athletic trainer working at NYU's Harkness Center for Dance Injuries and a private practice for about 10 years. And as I was working on site, I worked on site at dance colleges, dance companies, backstage at on Broadway shows, and as well inside the clinic. And I loved it. I still love it. But I felt like sometimes there was more to the orthopedic injury that the dancer was presenting with. So sometimes the dancer would get better. It was an ankle sprain. They do their rehab, they get better. But sometimes they weren't. And I realized there's a whole being in front of me that it's not just their ankle. Sometimes it was nutrition, sometimes it was psychosocial, such as stress or financial concerns or relationships. And the more I looked into different fields, did I want to go back to school for this or for that? The theory of acupuncture and Chinese medical model kept coming up. And I realized I was intrigued by it because at its core, it really seemed to be taking my working knowledge of the biopsychosocial model, which is how I worked with my athletic training hat on. And it was putting it into a much deeper context of all the things that all things are interrelated. And for us to be in balance, healthy, fully rehabilitated, we should consider and address our whole ecosystem and not just our sprained ankle. And so that led me down the road of going back to school for my second master's degree in acupuncture.
I love that because, even when I was in school, when I first was learning about the biopsychosocial model, I was really like, how is this not talked about more? Maybe it's just like in my like dance science scope of things like reading research and stuff, but I do feel like the model isn't really talked about that much. Like you said, people think dance science and dance medicine is just like injuries, right? Just treating
Mhm.
injuries when there's actually like more of this educational component behind it too, right? Of it, like you said, addressing
Absolutely.
the whole body and the whole mind, right? So like kind of
Mhm.
like mind, body, soul.
Exactly.
Yeah.
And we can't be everything to everyone. So
Right.
if our specialty is orthopedics and we see that there's something really driving from a psychological standpoint, then we should refer out to that. But I also think we should be mindful that we're not just treating a isolated body part or a kinetic pain that is just mechanical, right? Because there's a spirit, there's a mind, there's a digestive system within that person who also has the knee injury.
So do you find it hard to convince people sometimes that like that is also equally as important as like the athletic trainer stuff that you do? You know what I kind of mean?
I mean, I actually have not bumped up with that with dancers.
Mm,
I don't know why. Dancers seem to be a little bit more holistic in nature
yeah.
anyway. I'm
Yeah.
also in New York City, so I don't know if it's
That's
just the type of
yeah.
person who finds themselves in the chaos of New York City trying to be that, be the dancer here.
Help me.
But they're usually really open to, they're the first person like, I'm interested in that, or I've heard about that, or I
Mm,
don't know anything about that, but I'll try.
mm,
So I usually get dancers in my door much earlier in either their injury process or in their not feeling robust and well process versus the general population. I'm usually their 10th person down the line. I'm like,
right.
I tried all these things and now I'm frustrated. And my neighbor says I should try acupuncture. And I'm like, I don't know why it took me so long. But dancers don't seem to be in that. However, I do think all of us, we just don't realize that all the things that are making us feel not well when it's really just if we really are having neck pain, it's like, it's my neck. It's like, oh, it's my neck. But it really gets stirred up when
Other
I
things.
work with this person or I, different things, or when my digestive system's really bad, or if I haven't slept really well, or when I'm traveling, or um, so yeah, sometimes it's putting the dots together. But I think dancers on a whole are much easier to connect the
Oh
dots with
yeah,
than
I'm
some
sure.
other populations.
Yeah, like maybe, I don't know, maybe like studio owners, if you've ever dealt, or like educators, just in general, maybe would be a little more closed
Maybe,
off. Yeah.
yeah,
If they're just like, treat the injury and that's it. That's all we want to do. And you're trying to be
right,
like, well, there's a different aspect here to just their injury.
exactly,
Yeah.
yeah.
So was anything specific in your journey that really like catapulted you into like, I want to do this. Like I'm gonna become an athletic trainer and do this acupuncture work.
So it's funny. I never had any interaction with athletic trainers when I was younger, and then I only had like one or two exposures to acupuncture. So I guess I'm that kind of person who my curiosity and my want, like, I'm like, oh, I kind of dive in. But when I was younger, I was an athlete and a dancer. I started dance a little late. I was like fourth or fifth grade, but as soon as I started, I was like, oh, I'm in this. I was pretty like serious right away.
Yeah.
I went to a performing arts high school, well, half a day performing arts high school, half a day regular school.
Wow.
And then my last year of high school, I went to Alvin Ailey on a fellowship. So I was all in it for dance. And then
Right.
somehow when I was looking to go to college, and I think, again, this is part of the perfectionist person that I hope to not be anymore. But when I was younger, I was like, I can't just be a dancer. I have to have something else.
Of
And
course.
so when I was looking to go to school, sports medicine came up. And I was like, that's a really cool idea. These people know things about athletes, and they're applying science and things to help athletes become better or stay healthy. And I just was so intrigued. And at that moment, I was like, I'm going to make dancers my athletes.
Mm.
And so from that, I researched and found athletic training. So I went to undergrad as an exercise science athletic training major, not really knowing what athletic trainers did, except for I knew like the basic concept that they worked with athletes and that they helped them prevent injuries and rehab. And then when I got into the program, I made it very clear to my program director. I was like, I'm a dancer. I'm here on a dance scholarship. And I also want to work with dancers in this way as an athletic trainer. And I went to GW, and the program director was great. It was like, well, okay, we'll see what we can do. And so my internships, I got to go to Washington, a sports medicine clinic that worked with the Washington Ballet. I worked with the gymnasts. I also worked with water polo and basketball, but you have to do your thing with your rotations. Every moment I had a chance to work with dancers or someone in a population that was similar to dance,
Took
I
it.
did. And then that led me actually to go to Indiana University to get my master's in advanced athletic training and kinesiology. And there I was my graduate assistantship was working with the ballet dancers of IU. And that was great. It was like I was a full-time athletic trainer for the dancers there. So it's definitely on my fire, but it was great. I had a group of dancers that I really got to connect with and realize um, in a supportive educational way of how dancers were a little different than my sports teams.
Yeah.
And from there, it's always been dance ever since.
Mm. And then you said you got into the acupuncture stuff too. You said you have a master's in that too.
Yes. So acupuncture can either be a master's degree or a doctorate degree. I got a master's degree. And that was about um, 10 years into, maybe 10 or 12 years into working with dancers as an athletic trainer. Um, and then I've been an acupuncturist for this summer will be 10 years.
And so at this
So I've
point,
kind of blended them
I
together.
was just gonna say, at this point, do you blend? I mean, we'll talk about this a little bit more in part two with like your services and stuff, but like right now speaking, do you blend the both together?
Yes. So right now I'm in private practice, and I I offer dance medicine service is really kind of what my dancer service is. And I'm going to do whatever the dancer needs. It's almost always going to have an acupuncture component, but it could have more acupuncture and more manual therapy if the dancer is already in the care of physical therapists
Okay.
or athletic trainers or chiropractors. If they already have a really good, robust home exercise program, they know what they should be doing as warm up and cool down and what they're modifying. Then I'm doing a little bit less of the athletic training and more acupuncture. If I'm the only person they're coming to, then we're splitting our time depending on what's needed with hands-on work versus giving them tools to do at home. And that may be more lifestyle, like more acupuncture lifestyle things. And let's look at your diet. Let's look at your sleep hygiene. Let's look at stress management. But it also could be like, let's look at your warm up. How are you warming up? What are you doing? Let's take this. Let's not do this in class. Modify these jumps. So it just depends on what they need. Is kind of where I go with that.
And is there like a certain age group that you work with mostly?
I mostly work with collegiate and professional
Okay.
dancers. So I see some college dancers and then a lot of professional. I would say my main ages of dance is like 25 to like 40, but I also have 65-year-old dancers that are coming to me and they're still dancing. They're actively choreographing. They're actively dancing. They're actively teaching.
Wow.
I think my oldest dancer may be like in her 70s.
Oh my gosh.
Yeah.
You have a wide range. I love it.
Yeah.
Gives you more
I see
tools.
some little folk too, but not as much. So I see some younger dancers, but not as much.
And then how do you kind of see this progressing the field of dance science or like contributing to moving it forward?
Oh, well, I think in general, the field of dance and society in general has gotten much better at recognizing the whole person, but I think we can always move the needle from fine to thriving in that way. So with acupuncture, especially, I think it helps dancers and the people training dancers, right? Our dance educators, our choreographers, our administrators, to remember that we're more than a physical body. When I'm working with a dancer, I would say 75% is orthopedic, musculoskeletal treatments, but the other 25% has this undercurrent of the whole person. So, how's their sleep? How's their stress? How's their digestion? How's their menstrual cycle? What's their diet look like? That sort of thing. And then just by me asking those questions, it allows the dancer to it invites them to realize that those things are impacting them, right? Like, oh, I just thought it was my shoulder because somebody tugged on it yesterday. But like we kind of unravel and say, oh, right, but I also have pretty bad digestion and I don't feel good. Even when my shoulder was feeling good, I don't feel good. And so it invites them to think a little bit more of their whole person and how that's showing up for them. And then it invites them to ask me more questions. So then we can work on that, give them more resources. I always say, like, let's put this in your toolbox. So it's like a dancer toolbox. Yeah. So sometimes it's exercises. Sometimes this exercise toolbox is only for your injury. And then we're going to keep a couple of them that are your everyday dancer toolbox that you use for warm up or whatever. But I think it's like maybe a life toolbox instead. So instead of it just being exercise focused or physical focused, we are building resources for dancers and dance educators to know how to impact, especially if it's dance educators or choreographers or people who are influencing dance, of knowing, oh right, we should have a conversation about okay, we're going on tour. How is this sleep schedule or this tour schedule going to impact sleep? And do I have resources to give to my company members or, that sort of thing, or just making sure there's some metrics to look at. So I think in that way, me infusing acupuncture into more of like the physical world of dance and dance medicine gives us permission to look at things that are uh, like orthopedic in nature.
Right, because I think the hard part sometimes is, the assumption is like, how dancers will perform. Let's say they have a performance coming up and they think like how they will perform in that certain performance only is impacted by what they're doing in their class, right? When really there's like 20 other things that interplay. Like you were saying sleep. Like what are some other
Mhm.
things? You were saying sleep hygiene, you were saying nutrition, were you saying digestive health too?
Digestion. Right. So let's say you you tend to get bloated and gassy, and it happens to happen, later in the day at 3 o'clock. Well, you have a performance at 7. So are there ways that we can change that? So there's maybe you're avoiding certain foods, or you're eating at a different time, or you're eating smaller meals, right? So there's ways that we can optimize that you are feeling your best at 7 p.m. versus you're just coming off of feeling really bad.
Mm,
So digestion, sleep, stress, right? How we manage stress, do we get performance anxiety? What are our tools? What's in our toolbox for performance anxiety? Do we have some breathing techniques? Do you use essential oils to help? That sort of thing. Um, I've had a lot of dancers that they find one essential oil that helps them. And it lets them like breathe a couple times, get their nervous system relaxed. Sometimes they like rub it on the bottom of their foot to stimulate the foot, right? So we know it's going to be helping the proprioceptors of the foot, but then it's bringing energy down to ground them. So then they can feel like they're literally grounded on their feet.
and
And it's brought their energy down to kind of support that feeling of being anchored into the ground.
and I like that some of the things, I mean, really most of the things that you're mentioning today are like easy. I mean, you just mentioned the essential oil. I mean, that's low cost for the dancer, right? Maybe
Mm-hmm.
takes 3 to 5 minutes of their time out of a day, right? So we're talking low cost, we're talking like low barriers, right? Not everything has to
Yes.
be this giant, giant change, right?
Absolutely. Right. And then it's empowered because you don't rely on other people to do it. Right. So come see me when, you feel like you need a little help. I always say, like, once somebody's not in an acute injury state, um, like, I'm like, okay, come back and see me every 4 to 6 weeks, 8 weeks, depending on what you need. And we'll do, more supportive work, but on their own, they can be doing things. And we're all breathing. Maybe we're just not breathing optimally. So if we know, oh, I can do a square count breath pattern, 10 minutes before show time, that really helps my nervous system, right? Or I have a hard time falling asleep. I can do this kind of breath before falling asleep, that sort of thing. Like, it's nice to feel empowered. Like, you have tools
Yeah.
that you can do that doesn't cost money or costs very little bit of money. And it just takes a little bit of time. So maybe it costs a little bit of time,
Right, for sure.
but that's the investment. That's the
Yeah.
investment.
But I mean, and if it's worth it to them, then they'll put in the time. Yeah. If
Yeah.
they see the benefit, if they see the
Hmm.
reward. Yeah.
Hmm.
So, what advice would you give somebody if they were interested? You can either pick if a student was interested, let's say in athletic training, or interested in getting the acupuncture,
Okay.
either the master's or the doctorate.
I think I'm going to be a little general with this and
Yeah.
just say somebody, if they're interested in whatever professional field they're interested in, is at least I know two things that helped me and what I've worked with. When I was at the Harkness Center, I worked with a lot of students. I for a while I was the one managing internship placements and that sort of thing. And I would say interning or volunteering at places that you are interested in working, or in fields of that you're interested in working, and attending professional conferences and meetings. So internships allow you to see the workings of the field you think you're interested in. Right? Maybe you think you're interested in it and you come back and you're like, oh, it's really not what I thought it was. It allows you to observe and learn a lot. So internships are not about you pitching yourself. It's about you observing and learning and maybe applying the knowledge you came in with, but taking the knowledge you're gaining and applying it. So you're learning a lot. It also lets a potential employer know your work ethic and your willingness to learn and grow. And then a professional conference, in addition to being an amazing deep dive into learning, like, I don't know about you, but if I go to a 2 day conference, especially when I was younger, I'm like, write enough notes, right?
Constant.
So really good learning just for that. But then it's a natural place to meet the people that are in your field or related fields.
Yeah.
right? So, oh, I've heard about that. What is that? And like, oh, that's interesting. Let me learn more about that. So it can create relationships that you want to cultivate,
Yeah.
or it gives you ideas of like, if I thought this was the career I wanted, maybe I should look into this. And then you have a network of people that are like-minded. So
Right.
those are like the two main things. And then if I could add a third, I would say continue education. So once you land in whatever profession you're in, um, always keep learning, be a lifelong learner.
Yeah.
I think I've given good care throughout the years. I think if you asked any dancer that I worked with at 26 and 36 and now 46, I think they'd all be like, oh, she's helped me a lot. I've had a good experience. She seemed knowledgeable. But I'm a very different practitioner now than I was at 26 because I have so much more knowledge and skill set that I've accumulated. And I've only accumulated that from experience, right? Just working and doing. But some people just do the same thing day in and day out and don't open themselves to growth. And I think that's unfortunate for them, number one, and unfortunate for the people they're trying to serve. So if you can be a lifelong learner, be curious, go to courses, read new books, just be interested. I think you'll realize like so much of that layers into how you are working professionally. And then I know for me, it's made me a better person personally as well.
Oh yeah. I mean, because you probably layer all of these lessons into other areas of your life too.
Yeah, I don't
You
think
know.
we can't, right?
Right.
Like, I think it's just natural. Like, again, we can't separate things from what
Right.
we are a big sponge that things happen to and around. We can't remove ourselves. We're not in a bubble.
Right. It's not
Everything
like
is
A,
going to
B,
infiltrate,
C, right? It's not like A, B,
right?
or C. I love
Exactly.
that. So, from your specialization, is there something that you really wish you knew as a young dancer?
Um,
Everybody loves this one.
I know this is
I know.
hard. I think maybe this is from my specialization because maybe I've learned these life lessons from, uh, again, like doing more of the work. But I think it's being um, I tell the young dancer to be mindful of their self talk.
Oh,
So I think dance, even without meaning to, can create a lot of self judgment and comparison,
yeah.
right? So we're comparing ourselves to the person, to everybody else in the room. We're in front of the mirror, and honestly, it's a very self oriented place. So your goal is to craft your body to be able to look a certain way, perform a certain way. It's all about you. Oh yeah, and then you have to fit into the group, right? But it's really about you. So it's a very selfish um, world that we can live in. And so I would say it can lend us to be a little self-centered while also subconsciously not being very nice to ourselves, right? So I can't do X as good as her. I look like this. I'm so stupid because I can't get this, or I'm a failure because I didn't get this gig, right? So the little voice in our head is often really mean to us. Um, and so I guess I would say be mindful of how that little voice in your head speaks and let it be more positive. Like, it's for you that you went and did that audition. Maybe next time. Or I noticed that I did this, so I'm going to work on this. And that's okay that I didn't get this. Or, that sort of thing. Like being nicer to yourself. And then I also think have outside interests that don't revolve around you and your performance, so to speak. Right. So
Okay.
because everything could be all about you in dance,
Dance.
have other things that really you could be removed from the equation and no one would notice. And that those things should be giving you joy. Those things should be giving you a way to spend your energy and cultivate other aspects of life.
And you're speaking to more like trying different sports too, or are you talking more like just social activities?
I know I did lots of sports and I think that made me a better dancer.
Oh yeah, for
Right.
sure. Yeah.
I also didn't feel like, yeah, I was more well rounded, but I also think it might be um, join a club, join a, um, listen to different things. Like if you're always absorbing dance related content, you know, listen to a different podcast that's not dance related.
Right.
Maybe it's just funny, or maybe you really like things, I don't know, something random, like you really like birds. So you get into ornithology as well as dance, right? I don't know. That's a random thing, but something where we don't have our identity locked in around just dance.
Yes, exactly. Because it can become an obsession sometimes, a little bit too.
It can become an obsession.
Yeah.
And sometimes
It's not
it has to
really.
be a little bit of an obsession because
Right.
you have to put in all these hours and you have to be dedicated and you have to be disciplined. So there's a little bit of required obsession, but if it becomes like, I don't know, a disease that's throughout your whole being, that's a problem, right? If you don't have any friends outside of the dance studio, um, I think that's not okay, right? And it's hard sometimes because if you're in the dance studio 4 or 5 hours a day, that's the people you know. But making sure that you just have outside interests, and again, those interests aren't also like, okay, I'm also a diver,
Right.
which is also an individual sport about how you perform and act, right? So be on the soccer team
Yeah.
or
Something a little more different.
on the Glee Club, or I don't know, like I don't even know if the Glee Club exists anymore. I don't even know what a Glee Club is, but be,
Just
do
something.
something else that has nothing to do with your performance, so to speak.
And again, I think it's important because I think the assumption is dancers will see professional dancers and they'll assume, well, the professional dancers just dance all day and, they don't have outside activities. But really, if you really look at what they're doing on the weekends, I mean, a lot of the professional dancers now also do other things. Maybe they
Mhm.
just don't show it as much on their social medias and stuff. But I mean, it's, I hope it's as taught as what you're explaining today to professional dancers, that it's healthy to,
I hope so.
do other things. Yeah.
I also think programs like yours, whereas when professional dancers used to be younger, right? So if we're catching people, you know, in their teens, in their 20s, in their 30s, they're moving this on and they're bringing it into their life, and then whoever they're touching throughout their life in a professional way, like if they become a teacher, if they become a choreographer, if they become an administrator, that they're allowing this good stuff to seep through.
And I mean, that's the important part, is that we're making these small changes in the field, right?
Yeah.
Well, I say sometimes it can be a small change, right? It doesn't have to be sweeping and across the whole United States sometimes, right?
Right. Well, big changes are really hard to implement, especially
Yeah.
in an organization or an educational institution. But a small change where a dance teacher just starts the class with a 2-minute meditation,
Yeah.
or everybody shout out gratitudes,
Yeah.
that it took 2 minutes.
Right.
See, we haven't
Costs them
tried to
nothing.
implement a mindfulness course in the program, right? That might be great,
Yeah.
but that's a lot of work because you've got to go through a lot of systems to do that.
Yeah.
But an individual can add some mindfulness in their class.
Yeah. Teachers can add it in for,
Yeah.
for literally no cost to them.
Yeah.
And just
I know, like my colleagues and I have two colleagues, PT colleagues, that we present at IADMS a lot, and our last couple of presentations have been on neuromuscular, neuromotor warm ups, and part of it's like as a dance teacher, you can take a section of that and just add it to your warm up, right? You don't have to try to do
right, like the
30
full,
minutes of it.
Yeah.
But so like we can do it on a physical level or we can do it on a mental level. There's little ways that an individual can make changes that then trickle down.
Right. So you can take small pieces of it and like layer in into your environment if it works for you. Yeah. Yeah. Because places are different too. That's just
Right, exactly.
different cultures and stuff. Yeah. Awesome. Well, thank you so much for part one.
Oh, great.
All right, everyone, welcome back to part two. And now, first, Megan is just going to tell us a little bit more about what she does as an acupuncturist.
Okay, so some people might not know what acupuncture is at all. So let me give a little background. So acupuncture, the idea is that we are made up of energy, and certain parts of our body are more like wells of energy, or we call it qi in Chinese medicine. But our body's an electrical circuit, if you can think of it.
Yeah.
And we can tap into these energy sources in specific areas and help reset that circuit. So oftentimes, if we have pain, if we have dis-ease, if we have imbalance, then we either have energy that's not flowing, so we can be like a little deficient. So if you think of it as you're sick and you're tired and you're fatigued, or you if we look at it on an injury basis, maybe this is a tendonitis that never gets resolved. It's kind of always there. It's a little better, but not. That's more of a deficient injury. There just doesn't have enough energy, enough blood supply, enough whatever it is to heal. So that's a deficiency. Or we can have on the other side, like you think of it as a dam, so it's deficient on one side, then all that energy is going to be on the other side of the dam. So now we have an accumulation of energy, accumulation of blood, accumulation of pain, accumulation of cells that can cancer, like a cell accumulation. So that can create stagnation and a lack of movement and uh, pain. So this could be like a contusion. You smash, somebody kicks you in the thigh during partnering. You get a big hematoma. There's lots of bruising. That's congested. That's stagnation. Right. There's lots of different ways this can happen. This also can be just a muscle spasm, a tight calf. Right. And so what we're doing is first we're trying to reset the circuit breaker and allow easy flow of energy, easy flow of blood, easy flow of cellular matrix. So in general, that's the energetic aspects of acupuncture. And then for me, because I am an orthopedic sports medicine kind of acupuncturist, I do go into the muscular system and the fascial system. So acupuncture needles can go in and we can fasciculate the muscle, create a little baby contraction at the muscle, either at its motor point, if it's not, if it's not activating, if it's tired, if it's fatigued, if it's weak, we can go into the motor point and stimulate it. Or if there's a trigger point that is causing pain in that area or referred pain in other areas, we can go and fasciculate it with the needle, create a contraction that it fully contracts, so then it can fully release. And that's called dry needling in the worlds of outside of acupuncture. And inside acupuncture, we call that trigger needling.
Oh, okay.
Same thing, just different words. And so on that way, we are influencing the musculoskeletal system.
Yeah.
And then there's been really interesting research. A acupuncturist based out of Boston, I think it's at Harvard, has looked at acupuncture in the fascial system, and we see that the acupuncture needles, as they stay in the body, the fascial system will start to unwind and realign. Right. So we know as repetitive motion, repetitive postures, repetitive injuries, scar tissue, any of that stuff can influence our fascia and decrease its glide and slide. I like to think of fascia as like a cobwebby saran wrap.
Yeah.
Right. So it can move and glide when it's working well. But once we get a wrinkle in that saran wrap, it does not work very well. So acupuncture needles can help unwind that wrinkle and create the balance of the fascia again.
Yeah. So
And so on an acupuncture, like on a physical level, that's what I'm doing with the needles, is going in and either reworking the fascia and or decreasing muscular spasm or increasing muscular tone.
and so usually is this like an hour process? I know it kind of depends on the issue that you're dealing with, but about how long is the process?
My sessions are usually an hour or longer. It just depends. Some people have different setups. I work with my clients one on one the entire time. Other acupuncturists may be in the room for 15 to 30 minutes and they go to a different room. Because a lot of my population are dancers. There's a lot to do. And I keep their sessions down to an hour to 75 minutes and cost reasons for them to allow them to have access to my care. So I want to get everything done in one session. So oftentimes the needles will be setting in one area and we'll work on another area. So I might be doing some manual therapy to their calf while the needles are still in their shoulders and their back, or vice versa. Or sometimes I'm not doing anything and they're just relaxing because we need to calm their central nervous system. So it really depends on what's going on, who shows up at the time, what's going on in their system. But it usually is about an hour session and often is a front and back treatment.
And so after their, injuries have sort of improved, I know it can be different. Like you said, you're kind of dealing with like a million things, but are they also coming to you like maybe like a few months later just as like a checkup or kind of like repeat, you know what I'm saying?
Yeah.
That's
Ideally, in an ideal world, so if they're dealing with an acute injury or a chronic recurrent injury that's in a flare, I might see them once a week or once every 7 to 10 days for 2 to 4 sessions.
Okay.
And then once that's resolved, ideally, I say to dancers, especially if they're professional dancers, um, they should be doing some sort of intervention every 4 to 6 weeks. Um, so I'm like, come back and see me every 4 to 6 weeks. Or if we have a rotating group of practitioners, put me in that rotation, right? So if
Right.
they have a massage therapist and a physical therapist and an acupuncturist, they should be seeing one of those three people every 4 weeks, right? So it could be a rotation. I say that's a special recipe that the dancer has to figure out what they need themselves. Ideally, I would love them to all come and see me every 4 to 6 weeks because I know what I'm doing is different than what the massage therapist and what the PT is doing. But I am happy to have them doing any intervention every 4 to 6 weeks. So it's a tricky question. So yes, every 4 to 6 weeks would be an ideal way to keep and maintain. But if they're also doing other interventions, we can push them a little bit longer.
And
Being mindful of time constraints and financial constraints.
And then is there a situation where people are coming with like no real injury at the time, but they're just like wanting the work that you do? Just as like a
Yes.
reset? Yeah.
Well, that's the kind of the idea of that maintenance. So I'll have dancers who are like, I'm about to be on a really big push.
Yeah.
I'm about to start a really heavy rehearsal period and I want to feel optimal.
Yeah.
So they'll come in before being, feeling worn down. Or they're maybe in that big push and they know they still have 3 or 6 more weeks before they're in performance. So they'll come in during maybe the early stages of rehearsal process.
I like that because my assumption with acupuncture was like, oh, it's more just injuries, but I'm learning more about it today.
Yeah.
So, yeah.
And
it's way
especially
more
if they have other things going on, if they really struggle with sleep or digestion or
different.
menstrual dysfunction or, menstrual pain, that's important because that doesn't, especially if dancers really having a lot of menstrual pain and issues that you don't want to be performing in that state. So if we can regulate that, that would be a little bit more that we would do that more consistently to get them more regulated and feeling better.
And isn't it kind of crazy what's normalized in the dance world, right? Like, oh, it's normal for them to have crappy sleep. It's normal for them to have crappy nutrition, right? It's normal for them to be in this cycle of push, 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 right? But really, we're just sitting here today saying it's not normal, and let's
Not normal.
let's rewrite it. Yeah,
It's normal for anyone.
any human.
A lot of people are like, oh yeah, I'm fine with 5 hours of sleep. Well, we know that science says no, there's actually a lot of changes happening inside your brain and your body if you're not getting enough sleep.
It's a constant struggle sometimes, but
Yeah.
it's worth it.
Yeah.
So, what are some of your challenges that you come across?
I think kind of what you just said is like, I didn't know acupuncture does that. I didn't know I could have come to you for that. Especially since a lot of because I was working with dancers as an athletic trainer for 15 years before I introduced acupuncture. A lot of times it is more physical medicine that people are coming to me for, and it is my specialty. But sometimes it's like, oh right, I could have come in earlier when I was struggling with my stress and I hurt my neck, or oh yeah, my neck has been really bad and I realized it was stress. So that combination. Um, so I think that's a challenge of just awareness of what acupuncture can and can't do. Um, and then also, I mean, if I'm going to talk from a business side of things, my challenge is my zone of genius is dance,
Mm.
and dancers are underpaid,
No,
underinsured,
for sure.
and they do not have money. And it's really hard to have a business when you are trying to work with people who can't afford you.
Right.
And
Completely.
you really want to help them.
Right.
Right.
It's a
So
pain
that's
point.
been a challenge just as a business owner.
Yeah, because I mean, professional dancers can barely afford groceries, some of them. So, I mean,
Right.
it's sometimes it can be impossible.
Exactly.
Yeah.
And so, I mean, because of my background, I also work with athletes and just general orthopedic population. And I also do cosmetic acupuncture, which is completely different, much more on the cosmetic side. There've been all those lifestyle factors are related to what shows up on our face. But part of that is because if I want to continue to work with dancers, and I don't want to overcharge them, and I still want to actually give them discounts and be able to afford my services. I think it's very important that they are given support and resources. Then um, I want to be creative with how I can uh, keep my business while also helping them. And so part of it is
Right.
like offering, it's expanding my population, and then also expanding my services.
Right. Because it's hard because I mean, we were in their shoes. So
Mm-hmm.
we have these soft spots for them, right?
Mm-hmm.
But also, I mean, like we deserve to get paid for our services.
Yes.
So it's a
Yes.
fine line. Yeah.
We have
Yeah.
put a lot of time,
Yeah.
energy, and money into our knowledge,
Uh-huh.
and we are worth it, right. And
Right.
so part of it is like the positive self-talk and of making sure that we are, we're keeping ourselves up to the standards of what we're doing for patients. Is you don't want to keep discounting things because that's not good for your soul and your business.
Yeah.
But having like juggling that
Yeah.
as a business
Finding a
person,
balance.
it's an interesting conversation.
Yeah. Finding a balance. Because dancers, I mean, selling to dancers is just different than selling to your average person on the street.
Mhm.
Yeah.
And honestly, my dancers are the easiest ones. That's like I don't have
Yeah.
to sell anything to them.
Yeah.
Sometimes I'm like I can't take anymore, but yeah. Um, but they are a pain point. I mean, it's easy. I think it's easier to say like because I speak their language.
Right.
I
Oh
know their
yeah.
pain points. Naturally,
Yeah.
know their pain
Yeah.
points.
I mean, it's like, oh, sure. I trust
Right.
you. Yeah. Why wouldn't I
Yeah.
trust you? Yeah. So what is maybe one of your favorite parts of doing this?
I think connecting with people all day long. Like I get to share energy in the room with people, and I really enjoy that. Knowing that I've helped someone feel more at ease in their life, helping a dancer who is in pain go on stage and they're not in pain and they also have no fear around being on stage
Mhm.
and they can perform and just have fun. I mean, that gets me. That's just what pushes me through every day. Like I've impacted someone's life in a positive way and I've helped them and hopefully have given them a little bit of empowerment and tools so they can feel like they can do things on their own.
And I like how you said that too, because I like to say too, like, even let's say we have a dancer who's like the most skilled, the best technique, right? Like the cleanest lines, cleanest, like best strength, the best, best aesthetic on stage, right? I like to say sometimes too that even if they still have mental hurdles that they're going through, I feel like they're really going to only hit a certain ceiling, right? Like they're
Mhm.
gonna they're gonna keep hitting a ceiling at some point, right? If their sleep is disturbed, if they don't have the best nutrition in the world, right? I feel like they would hit a ceiling at some point, right?
I would think
Yeah.
so. Right.
Yeah.
And then also like what's their self talk? They might not
Yeah.
see their lines as being the best. They might not be think that they're the strongest. They usually they don't think they're the best in the room. You know what I mean?
That's the
So
hard part.
what the external looks like and what's happening, the internal dialogue and reality can be very different.
And so, would there be any more? I mean, you've given us so much wisdom today, but just to wrap up to part two, is there anything else you'd like to share with our audience today?
I think listening goes a long way to help someone else.
Mm.
I think if you're just there to listen and you don't even have to answer, I think that sometimes that's all somebody needs.
It's just holding the space for people.
Mm-hmm.
I mean, dancers get shunned. I mean, they don't really get the tools to self-express, right?
Well, self-express verbally,
Yeah.
right? Maybe they can self-express if they're allowed to do some improv and they're part of the creative process for movement. But how often are you speaking in a dance class or a rehearsal?
Right.
Not very much.
Yeah, like none. So encouraging
Right.
dancers to ask questions more and be vocal.
Yeah.
Yeah.
Or just allowing them to, to talk and
Right.
just being an open vessel to be there.
I think it's hard because like sometimes educators think they need to just fix, they need to get a solution to this problem right away, right? Be the fixers, right? But I think it's really important that what you're saying is sometimes we can just listen, and that
We can
in and
just
of
listen.
itself is
We
enough.
can say, do you want resources?
Yeah.
And if we have resources, we can get them. Or do you want help getting resources? But sometimes it's just, it's not a big deal of what they're telling you. It's just something they have to say. But yeah, I think listening is super important, and we don't always have to prove that we have knowledge or we have something to input.
Yeah. I think being there for them can be just as powerful as, giving them a piece of advice anyways, right?
Yeah.
Yeah. Well, thank you so
It's okay to
much.
say you don't know,
Right.
right?
Yeah, I like
It's
to
okay
say
to
that
say
too.
I don't know how to help you, but I'm willing to try to either help you myself or give you resources. But that's as I'm older, I allow myself to say
Yeah.
I don't know.
It's perfectly a normal thing to say.
Right.
I mean, it's a very honest thing to say.
Yeah, it's the truth.
I mean, yeah, no one knows everything, so
Exactly. Exactly.
yeah. It's funny that you say that because I had a post on Instagram like years ago that just said like, normalize educators saying I don't know. Because I mean, it's true. We can't have all the answers in the world.
Yeah.
But you can
That's
point
right.
them into a different direction, right? You can give them tools and resources.
Yep.
Or you can say, let me find
Exactly.
out about that, let me do some research and get back to you. Yeah.
Yes.
Well, thank you so much for today's amazing conversation, Megan.
Oh, you're so welcome. Thanks for inviting me. I've had so much
Yes.
fun.
Thank you. Oh my goodness, what an amazing conversation that I just got to have with Megan Richardson, who is an acupuncturist and an athletic trainer. So quickly, just summarizing a few main talking points that we got to today. So one of the things she started talking about is the biopsychosocial model, which is basically a model that considers all aspects of a human being, right? So she was kind of saying it in her lens of working with orthopedic injuries a lot, but she's saying it's not just about treating the injuries, that there's also different components that interplay as to how a human is going to perform or how a dancer is going to perform, right? So it's looking at the whole spider web or the whole pie chart and not necessarily zeroing on just one thing. She also really stressed, and I'm glad that I actually learned this from her today too. I mean, I learned a lot of wisdom from her today, but one of the things that I learned is acupuncture isn't only for just treating injuries as well. She also does things as just maintenance work. And, I'll let you guys go to that part of the episode where she really explains it because obviously it's her specialty. She also talked about how she addresses the whole body because now she really blends her work in athletic training and with the acupuncture work. I think that's amazing. And I think that's exactly what dancers need. Again, not just treating the injury, not just zeroing in on that one single injury, because there's a big pie chart that we also need to look at and zoom out with. She also talked about some of the other things when we're looking at the biopsychosocial model and really addressing the body as a holistic human being, is that there's also things like sleep, nutrition, digestion, right? There's a bunch of things. And then one of the amazing pieces of wisdom she gave us today was for dancers to really be aware of their inner self talk, right? We know that dance is like a visual thing, right? We're staring at ourselves in the mirror. We're trying to look a certain way. We're trying to make our leg look a certain way, shape our arm with this kind of shape, right? So she really wants dancers to be aware of like how they're talking to themselves internally, because again, all of these things play a role in the big spider web. Hi, everyone. I'm the Dance Scientist. Thank you so much for joining me on this amazing episode of the Dance Science Podcast. I'm your host, the Dance Scientist, and if you really enjoyed today's episode, please feel free to either leave a review, you can comment right on the episode below, or you can also send me a direct message right on Instagram. Again, thank you for joining me today on this wonderful, wonderful episode, and I look forward to seeing you in my next episode.